Thomas. I'm back from Doula Care of Maryland, and now we're going to go ahead and do a couple of demonstrations about counterpressure on a back during a wave. During quarantine, my daughter here is our model, so she's going to be helping us with the different parts of counterpressure. When a wave starts to begin, you're going to notice a woman's breathing start to change, whether it slows down, speeds up, or she starts vocalizing. At that point, you can start with counterpressure on the middle of her back. You'll notice during this that once you start with the counterpressure, please keep the same amount of pressure or the same consistency during the entire minute of a contraction, because if you let go in the middle of it, the weight of the baby, the ligaments, and the release of the counterpressure will all kind of intensify the moment for her, which she will let you know is quite uncomfortable. So if you can, it's kind of like start the way you want to finish. If you are able to put counterpressure, make sure you can do it for the entire contraction. If you can't, release slowly. So I'm going to use my model here on the back of the birth ball because it does give access to the back and right where you need to put your hands. There's a point in a woman's back that's right about here on the center and the lower portion of her back. You can practice, you can find where it feels good for her. The end of pregnancy massaging, this part of the area of the pelvis is really comfortable anyway. So it's kind of a fun thing to do towards the end of pregnancy, just to make sure that she's comfortable and give her a back massage. It's wonderful. But as the contraction begins and she starts to breathe heavily, putting this portion of your hand, which is the lower part of your hand, onto this part of her back and pushing directly upwards. So it's almost like a pressure if you're trying to lift just a little bit, and you're lifting the top part of the muscles against where all of the ligaments are pulling in her back as the wave begins. As it starts, you can always massage the top of her back. You can tell her to start doing her doula hulas. You can start telling her to move. Any of this is going to help her relax and cope, as well as having music playing in the background or whatever is making her relax for the moment. But using this portion of your hand is always welcomed, and it's in the middle and the back where you push up. When you get to the point where it's a little more significant of labor, the double hip squeeze is the one that tends to work really well in order to help support the pelvis as the baby starts to rotate down and maneuver down through the pelvis and underneath the pubic bone. She's going to show you, you can go ahead and stand up. There's these two parts on the hips, and there's a little, it's almost like you can feel the little bit of soft padding underneath the hip bones. And once again, your partner will be able to show you kind of where it is because this is probably aching towards the end of pregnancy. As the wave begins, once again, you use this portion of your hand in order to go ahead and put counterpressure there. And you make almost a fishing hook or the letter J in order to push in. And then that kind of use your biceps to then pull up on all of the muscles. So as the contraction begins, you can kind of put your hands here. You're pushing in and you're pulling up. And you hold that for the entire minute. And granted, that's a workout for you as well. And so it's one of those things where save this for when she's not coping as well on her own so that you can save part of the intensive exercise yourself to the part of labor when she needs it. Once again, try not to stop during the middle of the contraction because she will let you know that the sudden release and the sudden pressure it just intensifies the feeling, and it's definitely not as relaxing as making sure at the end of the contraction, as she starts to breathe normally again, you rub her shoulders, you tell her relax, and tell her she's doing a really good job. Because yet again, it's like one wave down and one wave closer to having your baby. So this was both the double hip squeeze and then the pressure directly up on the back in order to try and help with some of the comfort measures of labor. Hope that